The DSM IV Classification. Totaling over 300 of mental disorders can be found in the DSM IV, which is Diagnostic and Statistical Manual of Mental Disorders, 4th edition. Symptoms of panic disorder, which is shortness of breath, dizziness, unsteady feelings or faintness, palpitations, trembling or shaking, swearing, choking, abdominal distress, chest pain or discomfort, or fear of dying. Advantages. Psychiatrists can determine what mental disorder their patient is suffering from. Also, psychiatrists can dispense with the time-consuming psychoanalysis required by the traditional classification system. It can also be used to collect payments for their services from insurance companies. Disadvantage. This is merely descriptive, describing mental disorder with lists of symptoms without explaining how the disorder differ from one another. To be diagnosed, a patient must have at least 3 symptoms, but the manual does not explain why it has to be 3 symptoms. It can lead to a misdiagnosis of some normal behaviors as mental disorders. The focus on symptoms ineffability encourages psychiatrists. Since 1952, the DSM has been criticized for promoting the medical view of mental disorder as a biologically caused disease. But recently, psychiatrists are encouraged to see social factors as possible additional causes of mental disorder. Social factors in mental disorder. First, social class. It has been most consistently and most clearly in various studies with the disorder. People from the lower classes are more likely than those from other classes to become mentally ill. Social causation, which is lower class people are more prone to mental disorder because they are more likely to experience social stress, psychic frailty, infectious disease, lack quality medical treatment, coping ability, and social support. Social drift, which is mentally ill people from the higher social classes often drift downward into the lower class neighborhood. Gender. In most studies, women are found to have higher rates of mental disorder, but in some studies, men are the one with the higher rates. Study on specific types of disorder shows that women are more likely to suffer from depression, anxiety attacks, and post-traumatic stress disorder, while men tend more to have antisocial personality, paranoia, and drug and alcohol abuse disorder. The female role is relatively restrictive and oppressive, likely to confine the woman to her inner self. By contrast, the male role is more likely to encourage men to have to be assertive, bold, aggressive in social relations. This can be summarized that women are more likely to respond to social stress by developing depressive disorder.